the Oti Regional Health Director, the Dr. Oseiku for Afre, says he's worried about the low doctor-to-patient ratio in the region. According to Dr. Afre, out of the over 20 medical doctors posted to the region within the last couple of years, only 2 have reported. The region will also lose 4 of its medical doctors in the month of September to further studies. Peterson reports from the region and gives more details.
This is the second consecutive year the Oti Regional Health Director, Dr. Oseiku for Afre, has bemoaned the insufficient number of doctors in the region. According to him, the dwindling numbers and the unwillingness of medical doctors and other health workers to accept posting to the region is a worrying situation. He says by September 2022, the doctor-patient ratio would increase from 1 to 24,000 to 1 to 29,000.
The Oti region is vastly deprived, and that is one of the disincentives of attracting and retaining staff here. We've gotten cumulatively about 23 doctors being posted to us since 2020, but unfortunately, only one person reported. I think 2. Yeah, only 2 people reported, and it's a source of worry to us, a huge source of worry. So our doctor population ratio, we used to be about 1:21,000, increased to 1:24,000, and now we are doing around 1:29,000. And I'm very sad to inform you that this year, one school reopening somewhere September, October, we will lose about 4 of our doctors in a region to further studies.
The Regional Health Directorate has also declared zero maternal mortality rate for 2022 and beyond. So far for year 2022, it is the only region with zero maternal mortality rates across the country.
Pregnancy is not a disease, and we don't expect a woman who is also giving life to also lose her life. So I picked it personally with my team, and we put in measures to make sure that we bring it to the barest minimum. So we have been working with a policy of zero tolerance for maternal mortality. So consistently, we have reduced from 98 per 100,000 live births, and last year we did 53. And now we are doing 0. So I think so far in the whole country, we are the only region that has not reported any maternal death.
However, the stillbirth rate across the region is on the increase, with Krachi West and Nkwanta North leading.
Our stillbirth rate has increased marginally from 12% to 13.1%. And we've been able to zero in on where the stillbirths are coming from. Majority of the stillbirths are coming from Nkwanta North, which is a source of worry to us. They increased their stillbirth from 3.8 to about 17 or 18, which is an astronomical increase.
On COVID-19 vaccination, the region has so far been able to vaccinate only 29% of its population of 762,940 residents, according to the 2021 National Population and Housing Census figures.
We've been able to do 29% of people who are fully vaccinated in the region in terms of the populations that we've been given, and this figure is not too good. Actually, we started from about 15% for the past 2 months or 3 months, and we've been able to make some improvement, but still the improvement is not as good as it is.
Until leadership on all fronts work to make the region attractive, residents are very likely not to get the best of quality health delivery in the region. Peter Sanu for JoyNews.
Let's take you to the Bono East region. The Regional Health Director there has reiterated its commitment towards achieving its target of fully vaccinating 70% of the region's population. Regional Director of Health Services, Dr. Fred Adomako Boateng, at a half-year meeting to review the performance of the region, disclosed that with the region's case fatality far above the national average, a higher vaccination coverage is the surest way to saving the people against the COVID-19 pandemic. And as Habit has more.
Speaking at a mid-year meeting to review the performance of the region for the first half of the year and deliberate on how to improve the region's general healthcare delivery, the Bono East Regional Director of Health Services, Dr. Fred Admarko-Boateng, said the region is working towards achieving its COVID-19 vaccination target of 85% single dose and 70% fully vaccinated as a means of curbing the spread of the pandemic across the region.
Currently, with 835,086 eligible population for the vaccines, 433,781, that is 51, almost 52%, have been vaccinated with a dose. And 326,032, that is 39%, are fully vaccinated. Mr. Chair, the question that we have been asking ourselves, how do we reach the target of 85% single dose for Bono East? And how do we also achieve 70% fully vaccinated? Because you can see from all the figures that we are discussing that the game changer over here is the vaccination exercise, among other things. And therefore, looking at the nature of Bono East, there is nothing that we can do in a quest to overcome this COVID without actually increasing the uptake.
Dr. Fred Admarko-Boateng is optimistic that with the numerous challenges facing the region in terms of logistics and resources, a wider COVID vaccination coverage will help protect the region's workforce.
You know the challenges that we are having as a newly created region. We are less endowed in terms of equity, infrastructure, human resources. We are lacking. Even within Bono East, we are having that challenge. So the low-hanging fruit that we can really address is the having higher coverage for the COVID-19 vaccines. If we are able to do that, then it means that should we have any wave or surge, then we are well protected.
Chairman of the occasion and Director of the Kintampo Health Research Center, Dr. Kwaku Poku Asante, on his part expressed concern with the increase in the number of hypertensive cases in the region and people's reluctance to visit the hospitals for care.
At the research center, Kintampo Health Research Center of the Ghana Health Service, we have identified that within the community there are about 25% of people with hypertension. That is, every 1 out of 4 adults would have hypertension. But unfortunately, we are not seeing them in the hospitals. And this is because hypertension is a silent killer. Diabetes is a silent killer. If we do not screen early enough to identify them when they have not developed complications, they will now end up in the hospitals with complications. And some of them would die. I mean, hypertension, you can just die off like that with a stroke or a heart attack. Once we do that, we'll be making a huge impact on non-communicable diseases, specifically hypertension and diabetes.
The 2022 mid-year review, according to Dr. Fred Admarko-Boateng, is geared towards improving quality healthcare delivery rather than the number of visitations to the various health centers in the area. Anna Sabit, JoyNews, Kintampo.